Morning. Today I want to talk to you about Medicare supplements, also known as Medigap. You're going to hear both those terms, and I want you to understand that they mean the same exact thing. And a Medicare supplement is not health insurance. It is an insurance product through an insurance company that will fill in the gaps of original Medicare. So let's go over real quick what original Medicare is. I did do a video the other day, and I have multiple videos on this platform of what it is, but I want to go over it real quick in case you didn't see it. Part A is an Apple is going to be your hospital insurance, and you do have copays with it, and you do have coinsurance. The first 60 days of being in the hospital, 1 to 60, and it doesn't matter if you're in 1 day, 60 days, or 10 days, your portion is going to be $1,679. These numbers that we're talking about are for 2025. They will change in 2026. They change every single year. So January 1st, they always change. Now, if you're in the hospital for days 61 to 90, it's going to be $419 per day on top of the $1,676. If you're in the hospital for 91 to 150, it's going to be $838 per day on top of the $419 per day, on top of the $1,676 for the first 60 days. Now, if you have used any numbers between 91 and 150, those are your lifetime reserves, meaning that once you've used those numbers, or those days, they go away. They do not recalculate. But days 1 through 90 recalculate all the time for you. Okay? So you can see where having original Medicare Part A can be very expensive. Then you move on to your Part B, right? Your Part B is in boy, which is your medical insurance. You are going to have an annual deductible, which again changes every single year. January 1st, it will be something different. And that is $257 right now. Okay. It's not that high, but here's the catch. Medicare Part B as in boy is an 80-20 plan, meaning that Medicare pays 80%, you pay 20% after you've met that $257 deductible. Here's the catch though. There's no cap. So if your, medical bills are $10,000, $20,000, $100,000, you're still responsible for 20% of it. That is where a Medicare supplement, also known as a Medigap, comes into play. It is an insurance product where you pay another premiums. Because remember, with Part B, right now you're paying $185 a month for your Part B premium. It comes either out of your Social Security. You either get a paper bill or they just do a direct withdrawal right out of your checking account for it. So you'll have that cost. With a Medicare supplement, also known as a Medigap, there's also a premium for that too. And it ranges different all over the country. It can be $80 for some people, and it can be almost $600 for other people. It depends on the area you live, the zip code, whether you're male or female, and where, what carrier it is, right? Here's what I'm going to say. When you see a carrier that has that has never offered a Medicare supplement, also known as a Medigap before, and now they're all of a sudden they're going to be offering it, and the premiums are usually $600 in your area, almost, because some of them in New York are 500 and change. So I'm going to use the number 600. So say they're $600. If you see a carrier coming in and saying, oh, I can offer a plan G for $300, I'm going to tell you right now, they are going to go up in price. They are trying to get clients, they're trying to get insureds to get on their plan, and they will increase their prices. So while it's a good number now, I promise you it's going to get higher. I've seen it before. People have been like, oh, I've got on, ABC Medicare Plan G, and it was $70 a month, and now it's $150 a month. Why is that? And so we start looking around, and it's, the company just started offering, and they make an incentive, they make it exciting. Oh, we can help you afford this, but it will go up eventually. All right, so a Medicare supplement has a premium every single month that you're going to pay. So you'll pay the $185 for Part B, as in boy, plus you'll pay your premium for your supplement. But here's the deal with the supplement. While you're paying a premium every single month, once you have paid that annual deductible of $257, which changes every year, your medical bills are going to be taken care of. So let's just use easy numbers. We go to the doctor, the bill is $100. I've already paid my $257 deductible. Medicare is going to pay 80%, which is $80. And then I'm responsible for 20%, right, which is $20. But my Medicare supplement will pay for it. I do not have to pay for that because I have that coverage. Okay. So do you see how that works? So if I have, a bill of $100,000, Medicare is going to pay the 80%. Your Medicare supplement will pick up that 20% for you, okay? Because you pay that premium every single year. I tell people it's almost like prepaying your Medicare or your medical bills, and it keeps it kind of low for you. So if you're somebody that is coming on to original Medicare and you have a lot of health issues, or maybe you travel. I have clients that I've put on Medicare supplements because they are traveling in an RV and they do mountain biking and they do, a lot of hiking. They're very active people and they're all over the country. And a Medicare supplement is the best choice for them because, one, original Medicare is taking anywhere across the country, no questions asked. The only thing you have to do is make sure that the doctor or the facility that you're going to takes original Medicare. There are a few people, doctors and places out there that don't take original Medicare, so you want to make sure that they take original Medicare. But if you just say you reside in New York and you're in your RV and you're driving and you're in Kansas and you've decided to go hiking and you fall and break your leg, you don't have to go back to New York to get coverage or anything like that or get any kind of referrals. You just walk into the hospital and get taken care of. Or if you want to go see a doctor when you're out in California, or maybe you're sick and you have cancer and you want to go to the Moffitt Center in Texas, you just get on a plane and can fly to the Moffitt Center. No questions asked. You make your appointment and just go because you have original Medicare. It's taken anywhere that you want to go. All right. So with original Medicare and a Medicare supplement, also known as a Medigap, you do need to get a Part D as in dog prescription drug plan because your prescription drug plan is not covered by a Medicare supplement because it's an insurance product or original Medicare. So if you just have straight original Medicare also, you still need to have a prescription drug plan. If you choose not to get a prescription drug plan and then down the road you decide to pick one up because you're going to be taking medications and things like that, you will get a fine. The government will fine you for not having a prescription drug plan. So I'm just putting that out there. I'm going to do a video later on about fines and penalties with Medicare, but I'm just letting you know that there is a fine for not having a prescription drug coverage. If you have prescription drug coverage that is credible through maybe another company or something, then that will help avoid that policy penalty. I'm sorry. All right, so if you guys have any questions about Medicare supplements, how they work, Medicare supplements also known as a Medigap, how they work with original Medicare, or if you just have any questions in general, put them in the comments or reach out to me. I know a lot of people like to just private message me with their questions, and I'm all about that too. All right, have a wonderful day, and I will talk to you soon.